Morning, everybody. Eric Chaconis here for the PT on Ice Daily Show. I am one of our extremity management faculty, along with Lindsay Huey and Mark Gallant. Created that course about 10 years ago. It's crazy to see how fast the time has gone by. But Mark and Lindsay are all over the country teaching that course a lot this year. So if you've been looking to take extremity management, super fun course, all things exercise progressions, manual therapy techniques for the hip, knee, foot, ankle, and then shoulder, elbow, wrist, and hand. This is a great time to come take it with us. Lindsay is in Nebraska this month. She'll be in Nebraska, I think, in a couple weeks. And then Mark Gallant will be in upstate New York later in the month. And then in April, we'll be in Santa Rosa, California, and in Orlando, Florida, the Lake Mary area. And then we've got one in May in Milwaukee at Onward Milwaukee. So that'll be a lot of opportunities in the spring to take the course. And then we've got multiple offerings throughout the year. So check the website. PTOnice.com for extremity management dates throughout the entire year. The topic I would like to discuss today comes from a recent systematic review that we published from our Bellin College Doctor of Science in Physical Therapy program. So this is a post-professional program where physical therapists come to get a terminal degree to learn how to conduct research and teach. And that program has just graduated its first class. So this study comes from Matthew Vra and Christina Myers, two of our students in that program, along with the research faculty, Jody Young and Dan Rohn. So the four of them published this systematic review in the Clinical Journal of Pain just last month. And the title of the publication is 1 in 3 patients with chronic low back pain continue to use opioids long-term after spinal fusion surgery. And this study actually won an award at last year's AMP conference in Cleveland, Ohio. They won the Best Poster Award. So it's really impactful study where, they look back over the past 15 years, all the studies on spinal fusion surgery to try and determine are opioid use being tracked long-term for these individuals. And so the background is, obviously you've got low back pain, probably it is the most expensive medical diagnosis that we have, right? We don't spend more money on anything in all of healthcare than low back pain, $150 billion per year. And then you have this very expensive surgical procedure, right? So looking at the most expensive surgical procedure and how much are we utilizing drugs post-operatively for those patients? We all get it. Immediately post-operatively, it makes sense, right? You need to use narcotics in that acute phase when somebody's healing. So we're used to that, right? Total hips and total knees and spinal fusions, we're used to that. But I think we would all agree it's not a successful outcome if at 6 months or 1 year the individual continues to use opioids, right? That's not really a good outcome. You'd like to see people off drugs after the surgery to really deem it a success. So this is a really important question. And it's pretty interesting when you survey patients too, right? Individuals, patients, consumers of healthcare, they define, over 90% of them define a bad outcome. It would be a bad outcome if I was still taking drugs 6 months after spinal fusion surgery. So it's not an acceptable outcome. And what we know about the prior literature is that mostly we've been tracking surgical outcomes. So surgical outcomes like blood loss, infection rates, surgical time, hardware, right? Looking at the post-operative imaging and looking at hardware placement, and is the hardware in the right place? Does the hardware look good? And then obviously other important outcomes that have been tracked like pain and function, right? Post-operatively, those are very common ones to look at. But what they ended up finding was when you look at all of these studies, really, it was 329 studies that got pulled. 297 of them weren't tracking narcotic use at all. No tracking drug use. So, that's crazy. That's 90% of the studies published on spinal fusion do not track opioid use. Of the 10% that did track opioid use, you have about 11 of them looking at opioid use long-term. So 6% of the entire 329 studies actually look at long-term opioid use. which is really what we want to know, right? And of those studies, 35% of people continue to take opioids at 6 months. And they track them even longer than that, but that's like sort of the beginning of the definition of how you define long-term opioid use as the 6-month time point. But they followed them up beyond a year in most cases. Now that ranged from 6% to 85%. So you had some studies looking at up to an 85% rate of opioid use long-term. So that's not good, right? Not good. And I think if you take a 30,000-foot view of this and you look at our healthcare system, we continue to have huge gaping holes in our science that guides practice. And I think that's to be expected, right? I think we all acknowledge that this is challenging. It's a moving target as we tons and tons of resources and money are being poured into this. Lots of smart people are studying these questions. And it's work in progress, right? We'll get there. Eventually, we'll figure it out, and we'll figure out what the best management strategies are for people with chronic low back pain and where they should be, what pathway they should be in, and when they should be getting stepped care and all of that. We'll figure that out eventually. But personally, I think, when you have the most expensive diagnosis and you have super expensive intervention like fusion, that is not without risk, that has a lot of potential risks and side effects, right? Then I would think you would have science that guides practice to a degree on the efficacy of that procedure and on the outcome of that procedure. And you would certainly think you would be tracking narcotic use post-operatively. Because, especially after all of what we've learned over the past few years about the opioid crisis, downstream effects of these drugs, which are so significant and serious. And most people know long-term opioid use is not healthy, right? That results in hyperalgesia. These people tend to be more pain sensitive. They tend to have more pain. They tend to be less likely to return to work. They tend to have lower functional status. So long-term opioid use is not what we want. It's not a good outcome. It's not what anybody acknowledges as a proper or an ideal way to manage something like chronic low back pain, because it tends to leave the person worse off. Not to mention the other health effects it has on your GI tract. And when we look at longevity and when we look at the rate of addiction and dependence and all of that, right? It's pretty serious. So this is a really big deal. I applaud our research team, Dan Rohn and Jody Young, taking the lead, and Matthew Braun, Chris Myers for doing just such an absolute exceptional project. To think, that we have physical therapists studying this and publishing this in the Clinical Journal of Pain is really a big deal. I know that study's already had a lot of talk and discussion around it, but I just wanted to bring it to everybody's sort of, bring it in front of you today so that you can be aware of it and look at that. Clinical Journal of Pain just published last month. We have it in Hump Day Hustlin'. I'll make sure that it gets put in the next Hump Day Hustlin' so we can get a link out to everybody. But hope you have a great day. Take care, everybody.